In this chapter, we're going to talk about subscapularis management and humeral-sided releases. Glenoid exposure is mostly a humeral-sided issue. And what I mean by that is your exposure is greatly influenced by many of the steps that we take to prep the humerus. First, and one of the most important aspects of humeral-sided preparation is what do you do with the subscapularis? There are a number of different options. There's a subscapularis osteotomy, a tenotomy, a subscapularis peel, or a subscapularis split. Certain exposures involve working above and below the subscapularis and are outside the scope of this course. My personal preference is to perform a lesser tuberosity osteotomy. There are a number of advantages to that exposure. Certain advantages include the ability to visualize the healing of the bone to bone on x-rays, the speed at which it heals, and the relatively quick learning curve involved in learning how to do an osteotomy. Most importantly for me, removal of several millimeters of the anterior humeral bone allows for improved exposure to my patients. Certainly an arthroplasty can be performed well using the other methods I described, but for me, an osteotomy is my preference. In my hands, lesser tuberosity osteotomy is most important for total shoulder arthroplasty. My preference for reverse shoulder arthroplasty is actually a subscapularis peel off of the humeral side. I choose not to repair the subscapularis for a variety of reasons. Much of the recent research is focused on the importance of subscapularis repair in a lateralized construct, showing either no difference and in some cases a detrimental effect of repairing the subscapularis in a lateralized construct. So for me personally, I perform a peel of the subscap, releasing any degenerative tissue, infrequently repairing it back. Obviously for total shoulder arthroplasty, it's critical to repair back the subscapularis, whichever method you choose to release it. So my first step for performing a lesser tuberosity osteotomy is to identify the bicipital groove. We then take a saw to initiate a cut through the bicipital groove only. We don't extend the saw blade all the way through the humerus, as it would risk injury to the subscapularis muscle and other structures on the other side of the humerus. Therefore, it's a unicortical cut only. I then take a large flat osteotome and insert it into my cut surface. I have palpated the anterior aspect of the lesser tuberosity and felt the width of my cut. For me personally, I use about a 6 to 8 millimeter piece of bone, which is somewhat thicker than the described wafer in other techniques. Depending on the implant that you use and the geometry of the proximal body of the implant, you may have to make a smaller wafer for your subscapularis osteotomy or your lesser tuberosity osteotomy. In the case of the proximal geometry of the striker implant, I've got plenty of room to create a cut as big as I need. Inserting the broad flat osteotome, I then mallet it in and twist my hand, releasing the lesser tuberosity with the subscapularis attached. Very frequently, the subscapularis will keep the lesser tuberosity together as one piece, and then we can move on to the next step, which is our inferior capsular release. Once you've performed your preferred release of the subscapularis, a sharp homen placed along the inferior margin of the humeral head, frequently just under the osteophytes or the humeral neck, allows you, along with some external rotation, to gently expose the inferior portion of the humerus. Sliding the tip of a sharp homen along the inferior neck of the bone protects the neurovascular structures underneath and allows me to gently release the capsule, which is important to get the humeral head exposed. It's important to try to release the capsule as far posteriorly as you can while externally rotating the arm. Again, the axillary neurovascular bundle should be underneath the homen and therefore protected. So in this chapter, we've discussed subscapularis management and what to do with the inferior capsule in order to expose the proximal humerus. In the next chapter, we're going to talk about ways to Maximize your head cut, remove osteophytes, and make this procedure as easy as possible.